Imagine this: inside your body, a hidden danger lurks silently, one that could strike unexpectedly and lead to devastating consequences such as heart attacks, strokes, or even sudden death. We're talking about blood clots, a serious medical condition that doesn't always scream for attention until it's potentially too late. Think about it: would you know the warning signs if a blood clot was forming in your body right now? Most people wouldn't, and that's exactly why we need to talk about this. Recognizing these signs early isn't just important, it could be the difference between life and death. In today's video, we'll uncover the crucial symptoms of blood clots that are too dangerous to ignore. Stay with us to learn how you can protect yourself and your loved ones by catching these warning signs early. Let's get started. Number 1. Swelling. One common yet often overlooked sign of a blood clot is unusual swelling, which might occur in one or both legs, or sometimes in the arms. Imagine you haven't bumped into anything, nor have you injured yourself, but you notice that your leg or arm starts to swell. This could be a silent alert from your body pointing towards a blood clot. When a clot forms in a vein, especially in the deep veins of your legs, it can block the flow of blood returning to the heart. This is similar to what happens in a traffic jam. When cars block the road, no one can move forward, and everything backs up. Similarly, when a clot blocks a vein, blood can't circulate properly, leading to fluid buildup in the affected area, causing it to swell. It's essential not to dismiss this swelling, as it's not just an inconvenience, it could be a harbinger of more severe complications. For instance, part of the clot could break off and travel to the lungs, leading to a pulmonary embolism, which is life-threatening and requires immediate medical attention. If you observe this kind of swelling, especially if it's accompanied by pain and redness, it's crucial to seek medical advice promptly to ensure early intervention and prevent potentially severe outcomes. Remember, catching and treating a blood clot early can save your life, so keep an eye out for these critical signs. Number 2. Pain or tenderness. Pain or tenderness in the legs, particularly in areas like the calf or thigh, can be a red flag for blood clots. This isn't the typical muscle soreness that comes after a workout or from overexertion. Rather, it's a persistent, often unexplained pain that doesn't seem to align with your recent physical activities. Imagine how it might feel if the blood flow in your leg was suddenly squeezed by an invisible force. This is similar to what happens when a clot forms. The clot acts like a roadblock, preventing blood from circulating normally, which increases the pressure in the vein. This buildup of pressure can cause pain or tenderness in the area, making even simple activities uncomfortable or painful. It's crucial to differentiate this type of pain from ordinary aches, because ignoring it could lead to severe complications. Medical experts stress the importance of recognizing this symptom and seeking immediate medical attention if you experience such pain. The reason for urgency is that a clot can become more dangerous if it moves to the lungs or other vital organs. If you notice a pain in your leg that doesn't make sense based on your recent activities, and especially if the area also feels warm or looks red, it's important to consult a healthcare provider to rule out the presence of a blood clot. Early detection and treatment are key to managing the risks associated with blood clots effectively. Number 3. Redness or discoloration. When you spot unexpected patches of redness or discoloration on your legs, it's important not to ignore these changes. This redness, often localized and distinct, can sometimes show up with a bluish tint. What's happened beneath the skin is that a blood clot within a vein is causing inflammation. This inflammation, in turn, affects the surrounding tissues, manifesting as a visible change in skin color. The process is quite similar to what occurs when you have an inflammatory reaction from an injury or infection. The body's natural response to the clot treats it as an intruder. This response results in increased blood flow to the area, which can lead to the red or bluish discoloration that you see. The key difference here, however, is that the discoloration caused by a clot is not due to an external injury but an internal blockage that disrupts normal blood flow and venous return. It's essential to take such signs seriously. If you observe an area of your skin turning a different color without an obvious reason, such as a bump or bruise, it could be a clue to something more serious happening inside your body. In the case of blood clots, these visual cues are critical warnings. Seeking medical attention promptly can help determine the cause of the discoloration and potentially prevent complications like deep vein thrombosis or even a pulmonary embolism, which can occur if the clot travels to the lungs. Early intervention is key to effectively managing the situation and ensuring safety. Number 4. Warmth in one area. Have you ever felt an unusual warmth in a specific spot on your body without any apparent external reason, like being in the sun or applying a heat patch? This could be more than just a random occurrence. It might be a sign of a blood clot. When a clot forms in a vein, it can cause inflammation, which in turn increases the temperature of that area. This warmth is localized. It doesn't spread across a large area of your body but is confined to where the clot is disrupting blood flow. The reason behind this warmth is the body's response to what it perceives as an injury. The clotting process is essentially part of the body's way to stop bleeding, but when a clot forms inside a vein without a bleeding injury, it can lead to problems. The inflammation caused by the clot increases blood flow to that region as part of the immune response, intended to heal what the body mistakes as tissue damage. This increased blood flow raises the temperature, resulting in warmth that you can feel on the skin over the clot. If you notice this kind of localized warmth, especially if it comes with swelling, redness, or pain, it's important to take it seriously. These symptoms together can indicate a significant issue, such as deep vein thrombosis. I urge you to not overlook these signs. Consulting with a healthcare provider can help determine the cause and prevent more severe complications like a pulmonary embolism, which is a critical condition. Remember, recognizing and addressing these symptoms promptly could be crucial for your health. Number 5. Cramping. Cramping that occurs without an obvious trigger like intense exercise or dehydration can be particularly concerning. These aren't typical muscle cramps that might come after a long run or on a hot day when you haven't drunk enough water. Instead, the cramps associated with blood clots can feel similar but have a very different underlying cause. This type of cramping can persist and not ease up with the usual remedies, like stretching or hydrating, that typically help resolve ordinary cramps. When a blood clot forms in a vein, especially within the deep veins of your legs, it can restrict blood flow, leading to pain and cramping in the affected area. The cramp feels deep, often described as a sharp muscle contraction or a persistent throbbing that doesn't go away with changing positions or through massage. This is because the clot continues to block blood flow, maintaining pressure in the vein that manifests as cramping. It's important not to dismiss these signs as minor muscle issues, especially if they persist or are accompanied by other symptoms like swelling, redness, or warmth in the area. Such cramps are a red flag and warrant immediate medical attention. Ignoring these could lead to severe complications if the clot dislodges and travels to vital organs, such as the lungs, which can be life-threatening. Always err on the side of caution and consult with a healthcare professional if you experience unexplained, persistent cramping. Early diagnosis and treatment can be life-saving. Number 6. Shortness of breath. Experiencing shortness of breath is common after physical exertion or due to underlying health issues like asthma, but when you find yourself gasping for air unexpectedly while at rest, it's a different concern altogether. This type of breathlessness, sudden and unprovoked, can be alarming. It's important not to confuse or dismiss this symptom as a minor issue, because it may be a sign of something much more serious, such as a pulmonary embolism, a condition where a blood clot blocks one or more arteries in your lungs. When a clot travels to the lungs and causes a blockage, it disrupts normal blood flow and oxygen exchange. As the lungs struggle to provide oxygen to your blood, and your heart works harder to pump blood through obstructed lungs, you feel short of breath. This is not just a simple lack of air, it's a critical signal that your body isn't oxygenating properly. The sensation might be accompanied by chest pain, dizziness, or a rapid heart rate, intensifying the urgency of the situation. Recognizing this sudden shortness of breath as a potential red flag for a pulmonary embolism is crucial. If you experience this symptom, especially if it's paired with other signs like leg pain or swelling, immediate medical evaluation is essential. Early detection and treatment can dramatically reduce the risk of severe complications or even death. So, if you find yourself unexpectedly struggling to breathe, seek medical help right away. It's always better to be safe and have it checked out. Number 7. Chest pain. Chest pain can be one of the most alarming symptoms of a blood clot, especially if it feels sharp, pressing, or comes on suddenly without an obvious reason. This type of chest pain, often linked to a pulmonary embolism, PE, can feel intense, sometimes mimicking the symptoms of a heart attack. It may feel like a deep, stabbing sensation in your chest, or like pressure that makes breathing painful and challenging. Unlike typical muscular chest pain, which might ease with rest or changing positions, PE-related chest pain persists and can even intensify when you breathe deeply or move. When a clot reaches the lungs and obstructs blood flow, it strains the heart and lungs as they work harder to supply oxygen to your body. This creates a painful sensation that is difficult to ignore. The similarity to heart attack symptoms can make it hard to distinguish, which is why any chest pain, especially if accompanied by shortness of breath, rapid heartbeat, or dizziness, should be treated as a medical emergency. If chest pain appears alongside other signs of blood clots, such as leg swelling, warmth, or redness, it's essential to seek immediate medical help. Acting quickly is crucial because a pulmonary embolism can be life-threatening. Remember, it's better to err on the side of caution and get checked out. Seeking timely intervention could save your life, especially when these symptoms are recognized and addressed without delay. Number 8. Rapid heartbeat, tachycardia. Experiencing a rapid heartbeat, or tachycardia, can be startling. It's your heart's way of telling you something's not quite right. When a blood clot impairs circulation, your heart may beat faster as it tries to compensate for the reduced blood flow. It's working harder to pump blood through blocked vessels, trying to maintain adequate circulation and oxygen delivery to your tissues and organs. Now, it's important to differentiate this type of rapid heartbeat from those caused by less concerning factors like caffeine consumption, stress, or exercise. While these causes are generally harmless and temporary, a rapid heartbeat due to a blood clot can be a sign of a serious problem, especially if it occurs suddenly and is accompanied by other symptoms like shortness of breath, chest pain, or dizziness. It's vital not to ignore a rapid heartbeat when it comes with these other warning signs. This combination can indicate a potentially life-threatening condition such as a pulmonary embolism, where a clot has traveled to the lungs, or deep vein thrombosis, where it's located in the deeper veins of the legs. In these scenarios, the fast heart rate isn't just a symptom, it's a cry for help from your body, urging immediate medical attention. Remember, recognizing these signs early and acting on them can make a significant difference in outcomes. Always err on the side of caution and seek professional advice if you experience a rapid heartbeat along with other signs of a blood clot. Number 9. Coughing up blood. Coughing up blood, medically known as hemoptysis, is a severe and alarming symptom that can indicate significant issues within the lungs, including complications from a blood clot. When blood appears in your cough, it's not just a symptom to be wary of, it's an urgent sign that your lungs may be suffering from damage or distress. This can occur when a clot, lodged in the pulmonary arteries, impedes blood flow and increases pressure in the delicate capillaries within the lung tissue, causing them to rupture and bleed. The sight of blood in your sputum is undeniably distressing, and understanding its severity is crucial. While it might be startling, it's important to remain calm and act swiftly. Hemoptysis due to a pulmonary embolism is particularly serious because it indicates that the clot is affecting the lung's ability to oxygenate blood and maintain proper circulation. This isn't just a cough, it's a potential medical emergency where every second counts. If you or someone else experiences coughing up blood, especially if accompanied by other symptoms like sharp chest pain, shortness of breath, or a rapid heartbeat, immediate emergency help is required. Don't wait or attempt to self-diagnose, seek professional medical attention right away. This symptom is a critical sign that needs prompt evaluation and treatment to prevent more severe consequences. Remember, recognizing this symptom and understanding its urgency could very well be life-saving. Number 10. Dizziness or lightheadedness. Dizziness or lightheadedness can often be dismissed as a minor nuisance, perhaps caused by standing up too quickly or not eating enough. However, when this symptom is a result of compromised blood flow due to a blood clot, its significance increases dramatically. This type of dizziness occurs because the clot can restrict blood flow, reducing the oxygen supply to the brain, which is crucial for maintaining equilibrium. When your brain doesn't receive enough oxygen, it can lead to feelings of instability, disorientation, or even fainting spells. It's important to recognize the difference between common dizziness and the more concerning type that could be linked to a blood clot. Common dizziness is usually fleeting and can often be remedied with simple measures like hydrating or resting. However, when dizziness is persistent, accompanied by other symptoms like shortness of breath, chest pain, or a rapid heartbeat, it should not be ignored. These combinations can indicate serious health issues, such as a pulmonary embolism or deep vein thrombosis, where quick medical response is critical. If you experience such dizziness, especially in conjunction with other warning signs of a blood clot, it's crucial to seek immediate medical attention. Dismissing this as just another dizzy spell could delay essential treatment and potentially lead to severe complications. Always err on the side of caution. Recognizing and responding to these signs promptly can be essential for preventing serious outcomes and safeguarding your health. Number 11. Severe headache. Severe headaches can sometimes be just a regular discomfort we all experience now and then, but if a headache is sudden and intensely painful, it might be a sign of something much more serious, such as a blood clot in the brain, known medically as cerebral venous sinus thrombosis, CVST. This condition occurs when a clot forms in the brain's venous sinuses, preventing blood from draining out of the brain. As blood backs up, it can lead to increased pressure within the skull, manifesting as a severe headache. The headache caused by CVST is typically very severe and may feel different from any other kind of headache you've experienced. It can be accompanied by other worrying symptoms like vision problems, nausea, vomiting, dizziness, or seizures, indicating the potential for stroke or brain swelling, both of which require immediate medical intervention. It's crucial to understand how to distinguish between a common headache and one that could signify a blood clot. A headache linked to CVST or other blood clot conditions isn't likely to be relieved by over-the-counter pain medication and isn't something to try to manage on your own. If you or someone else experiences a sudden, severe headache, especially with any other symptoms of a clot, it's vital to seek emergency medical help right away. Recognizing these signs and acting quickly isn't just cautious, it could save a life, preventing severe complications or irreversible damage. Number 12. Sudden vision changes. Sudden changes in vision can be unsettling and are often a sign that something serious is happening with your health. In some cases, These changes can be caused by blood clots that block blood flow to crucial parts of the eyes. When a clot interrupts the normal circulation of blood, the cells in the retina or other parts of the eye may begin to suffer from a lack of oxygen. This can manifest as blurred vision, partial or complete vision loss, or seeing dark or floating spots. The stakes are high with these symptoms because, without prompt and effective treatment, the loss of vision could become permanent. The blockage caused by the clot prevents vital nutrients and oxygen from nourishing the eye, and without these, the delicate tissues of the eye can sustain lasting damage very quickly. If you experience a sudden, unexplained change in your vision, such as blurriness, blind spots, or total loss of sight in one eye, it's crucial not to dismiss it as something minor like eye strain or fatigue. This is a situation where immediate medical evaluation is necessary. By seeking urgent care, you can dramatically increase your chances of a full recovery and reduce the risk of permanent damage. Always treat sudden vision changes as a potential medical emergency. It's one scenario where acting quickly can make all the difference in preserving your sight. Prevention tips for blood clots. Preventing blood clots is crucial for maintaining good health, and it starts with a few key lifestyle changes. First, keep moving. Regular exercise boosts circulation, which keeps blood from pooling and forming clots. Whether it's a brisk walk, a bike ride, or any activity that gets your heart pumping, staying active is your first line of defense. Next, stay hydrated. Drinking enough water thins your blood, making clots less likely. Also, remember to stand up and stretch your legs regularly, especially during long periods of sitting like on flights or at your desk. For those at high risk, compression stockings are beneficial as they help reduce swelling and improve blood flow. Managing chronic conditions such as diabetes, high blood pressure, and heart disease is also vital, as these can increase clot risks. Lastly, a healthy diet rich in omega-3 fatty acids and antioxidants can support vascular health and reduce clotting risks. Together, these strategies form a comprehensive approach to preventing blood clots. Risk factors for blood clots. Understanding the risk factors for blood clots can significantly help in prevention and early detection. Certain medical conditions such as atrial fibrillation, cancer, and inherited clotting disorders notably increase the risk as they affect how blood flows or clots. Similarly, surgeries, particularly those involving the legs, or any significant injury can immobilize you, slowing down blood flow and raising the likelihood of clot formation. Extended periods of inactivity, like being on bed rest or sitting through long flights, also contribute to this risk. Lifestyle choices play a big role too. Smoking, obesity, and even pregnancy can elevate your chances of developing blood clots. Moreover, age is a factor. Older adults are more susceptible, as is genetics, with a family history of clots marking increased risk. Awareness and proactive management of these factors are key in reducing your risk of serious health complications from blood clots. What to do if you suspect a blood clot? If you suspect you might have a blood clot, it's important to act with caution and urgency. First and foremost, avoid massaging or pressing on the area where you suspect the clot is. This could cause the clot to move to critical organs like the lungs or brain, leading to serious complications. If you experience severe symptoms such as intense chest pain or sudden shortness of breath, it's crucial to call emergency services or head straight to the emergency room. These symptoms require immediate medical attention. For diagnosis, medical professionals typically use several methods, including ultrasounds to see the blood flow in your veins, blood tests like the D-dimer to detect substances that clots release, and imaging scans to view the inside of your body. These tests help confirm the presence of a clot and guide the necessary treatment to manage it safely. Treatment options. treatment for blood clots often starts with anticoagulant medications, commonly known as blood thinners, which help prevent existing clots from growing and reduce the risk of new clots forming. In emergency situations where a clot needs to be dissolved quickly, doctors may use thrombolytics, powerful drugs that actively break down the clot and restore blood flow. However, because these drugs carry a higher risk of bleeding, they're usually reserved for life-threatening cases. For clots that are large or resistant to medication, surgical intervention, such as a thrombectomy, may be necessary to physically remove the clot. After treatment, it's essential to follow your doctor's advice closely, including taking prescribed medication and making any recommended lifestyle changes, such as staying active and avoiding smoking. These steps help reduce the risk of clots recurring and support long-term health. Staying consistent with prevention strategies is key to avoiding future complications. Myths and misconceptions about blood clots. There are several myths and misconceptions about blood clots that can lead to confusion about who is at risk and the seriousness of symptoms. A common misconception is that blood clots only affect older adults or individuals with poor circulation. In reality, blood clots can happen to anyone, regardless of age or overall health, due to a variety of risk factors including immobility, certain medications, and surgery. Another frequent misunderstanding is assuming that all leg cramps are harmless and simply due to overexertion. While muscle soreness from physical activity is common, persistent cramping, especially when accompanied by swelling or warmth, could be a sign of a blood clot and should not be dismissed. It's important to address these myths with a tone that is both informative and reassuring, providing practical advice without causing undue alarm. Understanding the true risks and recognizing the real signs of blood clots can empower individuals to seek timely medical advice and can ultimately contribute to better health outcomes. Being well informed is the best defense against the potential dangers of blood clots. In conclusion, taking charge of your health by being proactive and attentive to changes in your body is vital. If you notice any symptoms we've discussed, don't hesitate to seek medical advice. Remember, listening to your body and catching signs early can be the key to preventing serious complications. Blood clots can be managed effectively with prompt medical attention, so it's crucial to act quickly when symptoms arise. Stay informed, stay vigilant, and always prioritize your health. Early intervention can save lives, and it starts with you. Stay safe, and take care of yourself and each other.